class 12.
Good morning, sir. Wishing you a very happy Doctor's Day. I'm Sneha from class 12. So, what made you to become an oncologist? It's a very hard topic to study.
Not really. All the topics are hard. All topics are equally hard or difficult, depending on your liking. Oncology is a field. Actually, a lot depends on what kind of guidance and what kind of teachers you get. After I completed my MD in internal medicine from Sassoon, I wanted to experiment and see which field I would prefer to continue for the rest of my life. So I was working as an intensive care physician in Laxmi Hospital. I didn't like intensive care that much. I was toying with the idea of rheumatology and oncology because both are upcoming fields, fairly challenging fields. So I decided to go to Tata Hospital and see how things are happening there, what kind of work it happens. So I joined Tata Hospital in the month of August 1999, and it was a very wonderful experience. The information which you have about cancer out of Tata and the information which we have about cancer inside Tata, there is a sea change of information. So I found it very challenging and very rewarding as well. It's quite rewarding. See, when a cardiologist tells a patient, when he treats a patient with, say, heart problem, he does a bypass surgery, he puts in a stent. After that, the patient has to undergo several restrictions. You can't eat this, can't eat that, do that, don't do this. Once a patient is cured of cancer, he is a free bird. He can do anything he likes, he can eat whatever he likes. So it is otherwise very rewarding. Right now, we are at a phase, especially in India, where we are looking at the treatment aspects of cancer. Like we are more excited about the treatments in cancer. It is like when you are learning a new subject, or learning any new thing. So you are learning how to ride a bicycle. Your first aim is to stay in the seat and ride the bicycle without falling off the seat. Then gradually, as you become proficient in riding a bicycle, then you also learn additional skills like talking to your friend who is riding beside you, or maybe ride with only one hand, or ride fast, or ride slow cycling. You try to acquire further skills. So that is how we are also growing in the field of oncology. Earlier we were struggling to get patients for treatment. The moment people used to hear the word cancer, they used to go there and not take treatment. Now we are coming back to that area where people are coming for treatment. They want treatment. Now it is our job to find out different treatments, which treatment suits which patient and which treatment works best for which patient. That is our primary job, and that is what we are doing now. And from here now we have to go on, we have to go better. Right? We cannot just be happy with good. We are good now. We are treating a fair number of patients. A fair number of patients are doing well with cancer treatment, and you see examples around you who have received treatment and who are going about. Earlier on, you only heard that somebody had cancer and he passed away. Now you see people, a lady walks around with short hair, she tells you that she's had cancer and she's now okay, she's back to work. So right now we are good. The aim is to be better and better. So the next step which we are aiming to is improvisation in our present treatment modalities. Personalization. So which treatment suits which patient the best? This is what we are focusing on. The most important aspect is prevention. Prevention and early detection. These can never be overemphasized. It is always relevant in all cases. It is always important in any part of the world, whichever area you practice. You need to have people coming to you early for treatment. Not only this holds true not only for cancer but for many illnesses. If you have a patient who has a little bit of chest pain, he comes to you, he'll probably be better with simple treatment. If he comes back with a heart attack, then obviously you are going to need a bypass surgery or something like that. So these are things which are true for all aspects of medicine, but more true about cancer because the tumor keeps growing. And then treatment becomes more and more difficult, more and more costly. That is another aspect which is coming up in the field of oncology, is that of pharmacoeconomics. So early detection doesn't only help the patient, but it helps the country as a whole, because you are going to spend an enormous amount of money on somebody who has stage 4 cancer, and the end result is probably not going to be good. Whereas you may spend much lesser amount on a person who has stage 1 cancer, but you will have much more rewarding results, so that person becomes a fruitful asset to the country. That is what we are now moving on to, is taking care of the fringe elements. So people who are elderly. We are a growing nation, we are a very populous nation, we have a lot of elderly people. So extremes of ages is always a neglected element. Pediatric population, luckily, the results of cancer treatment are very critical. You treat a kid with cancer, the results are very good, they tolerate treatment very well, they become okay and they probably forget all about it. But elderly population, especially people above the age of 75, they get cancer. So it is difficult for them to cope up with treatment. There are several other issues. They have other medical issues. Somebody has a heart problem, somebody has diabetes, somebody has kidney issues. So putting together all these things, how to tackle these patients, is something which we are working on. There is a lot of future in cancer therapy. It's one of the fastest growing fields in medicine right now. Oncology probably is the best place to be right now, and probably in 15-20 years, next 15-20 years, it's going to be very fast and very rapidly developing. So what I learned in the way I was practicing, say lung cancer. I was practicing lung cancer in 1999 when I joined Tata Hospital. From there, today in 2023, the scenario is almost 180 degrees opposite. It is completely different. What we were doing in 1999, even at Tata Hospital, and what we are doing today is markedly different. Oncology is a very good field. Oncology is a very challenging field, but nevertheless it is also very rewarding, and a lot of it is happening. Lots.
So, but many people find that cancer is a deadly disease and they get scared of it immediately as soon as they hear the name of cancer. So, how do you convince the patients who come to you, or how is it that they get to know that I have cancer? Like, what are the symptoms of it?
Most of the patients who come to you for treatment are the ones who have an idea about cancer. Very few patients actually get to hear the diagnosis from you. Most of them already know. Nowadays, everybody is a literate person. Everybody has internet in their pockets. So, googling a particular phrase on your medical report is not difficult at all. You can just type on Google, all the information comes in your hand. So 90% of my population knows when they enter the office that XYZ person has, we are going to see Dr. Deshmukh because you have this kind of a problem. So breaking the diagnosis is not a big task at all. That is one thing. Second thing is now how to break the task, or how to break the diagnosis, or how to tell the patient. Most of these patients are willing for treatment. They have come to you with a clear idea that well, they want a treatment. They have a problem. They have not come to you with a diagnosis. They have come to you with a problem. A lady comes and tells me that she has a lump in the breast. That is a problem. The diagnosis, I am the one who is going to make the diagnosis of cancer or tuberculosis or whatever. So 98% of the population is going to go through the phases. It is a phenomenon called Kubler-Ross phenomenon. It is a well-known phenomenon in psychiatry. So whenever you are diagnosed with any troublesome problem, it may be cancer, it may be diabetes, it may be heart disease or kidney problem, any problem. And a man goes through 5 phases, like a human being goes through 5 phases of acceptance. First is denial. He is going to deny. This report is wrong. Let's take a second opinion. I don't think this is my report. There must have been a mix-up at the lab. Deny. Second is anger. Why did it happen to me? I don't drink. I don't smoke. So that is anger. Third is bargaining. Okay, so I won't go for surgery. I will only take radiation. I won't take chemotherapy. I'll take only tablets. That's bargaining. Fourth phase is depression. Obviously, you get depressed, you feel sad. Person starts yelling at his family or wife or kids or whatever, or probably just sulks in the corner of his house. Something. Finally, after going through all these 4 phases, it comes to the final phase of acceptance. Now, depending on the person's mental makeup, they spend a varying amount of time in this. Some people remain in denial for their life. They keep on arguing with staff, with doctors, with the other hospital workers and everybody with their families. They keep on checking their reports, spend time, they take 1,000 opinions and all those things. Some people continue to remain angry, perpetually. They keep on fighting with their family because they're dead. Some people will keep on do bargaining. And some people remain depressed forever. But 98% of the crowd goes through these 4 phases and comes back to me saying, okay, then I've got it, now I have to take it. So they come choice. 2% population remains in one of these, this gets stuck. Not that all of them don't take treatment. They do take treatment because everybody is scared for life. Nobody likes to die. Nobody is very keen on dying, or nobody has planned his death. Everybody has, even a 100-year-old granny, you tell her that she has a problem, she says, okay, so give me some treatment. She wants to live. So everybody will take treatment, but they will not be as happy or as comfortable in treatment as the remaining 98%. They will keep on finding faults. They are the ones who keep shopping from one hospital to the other, keep telling you, keep writing nasty things about healthcare in general. Everybody is a thief and this and that. So this is 2% population. You don't look at it. You look at the 98%, which has gone through all this and has come to terms with the disease and has come to you for treatment. These are the ones who treat.
So as you said that you had wonderful experiences in Tata and doing your internships around. So would you like to share us an experience which is memorable to you and you still remember it?
Oh, many. Tata Hospital is a very good place. If you ever get an opportunity to work there, you should take that opportunity. There was a gentleman, he was a bus conductor, young boy, 23, 24 years old, just started his job as a bus conductor. And he had a small farm in a place called Alumnus, which is south of Maharashtra, the border of Karnataka. So actually well off, government job, farm. So he got cancer of the testis, and the same cancer which Yuvraj had. And he came to Tata for treatment. He started on chemotherapy, didn't do well with chemotherapy. He responded very well to chemotherapy. So one day I saw him crying at the gate of Tata. So I asked him why is he crying, why is he sitting there? My reports are not good, so my family has decided to take me back to the village and we probably just stay there. So I spoke to my boss at Tata. This is what is happening, we shouldn't go home like this. He said, yes, why is he sending? Why are you sending him home? Let's get him admitted. The family said, we are not going to send. We spent our money for the first treatment and it has not worked. It is up to you. That man stayed on the footpath of Tata. I had 2 places to stay. He used to stay on the footpath of Tata. And then we used to, there are people around. Tata is it's like a big community in itself. There is an NGO which gives you breakfast in the morning free. There is somebody in the afternoon who gives you lunch. There are people around who will give you a place to sleep and all. So that happened. And he completed 2 cycles. He started doing very well. Doing very well. So then the family came back. Then they realized that he did well. He had to treat him well. He did well. He got cured completely of his testicular cancer. So that boy didn't give up. The young guy, 23, 24-year-old guy, he didn't give up. He stayed on the footpath at Tata. Mumbai footpaths are terrible. In the rains, in the scorching heat, but he managed to stay there. He managed to stick around and stay there. So that is very important. That you need to stick to your plan and make sure that you take your treatment well.
So, like in day-to-day life, what are the most common cases that comes to you?
Commonly in India, to us, breast cancer amongst females, cervical cancer, ovarian cancer, these are gynecological cancers, female cancers. In men, it is oral cancer, lung cancer, cancer of the large intestine, cancer of the other organs like kidney, bladder. These are common cancers.
How can we prevent from getting cancer? Like in day-to-day life, what exercises or anything habits?
So there are some very simple things about cancer which we need to understand. That prevention is not always feasible. It is possible in some cancer, not all, one. And even if you cannot prevent cancer, you should, if you obey certain rules in life, then you will be better equipped to fight cancer. It's like I tell my patients that you are driving a car. You are driving a car which is not very well maintained. The brakes are a problem. The clutch is not working very well. The engine is not serviced properly. If this car gets into an accident, the chances of the occupants of the car coming out unhurt or unscathed is very good. There's a good chance that this occupants of this car are going to probably be very badly injured. If you have a well-maintained car which has all the other good things, it has proper brakes and proper shock absorbers, engine and all is working fine, airbags are working. In this car, the occupants of such a car are probably going to come out unscathed. So, accidents are likely to happen. If your physical capacity, if your physical health is good, you will still cope through it. So, the basic simple principles are staying away from all kinds of addictions. Tobacco and alcohol are one of the worst addictions which we see, and they are the ones which are essentially preventable causes of cancer. Tobacco has no health benefit, contrary to what people send on WhatsApp or YouTube influencers. There is nothing called healthy alcohol and nothing called healthy tobacco. Both are bad. Any amount of tobacco and any amount of alcohol is bad for you. If you stay away from tobacco and alcohol, you have managed to reduce the risk of quite a few cancers by itself. That is one thing. Second thing is physical activity for at least 150 minutes per week. It is not very difficult. You look at it. 150 works out to about less than 30 minutes a day. It is not very difficult. So, staying away from tobacco and alcohol, good physical activity, diet which is rich in fruits, vegetables, avoiding junk food. People are, again, it all comes down to obesity. Having fat, fried, a lot of junk food and meats in the diet is going to make you more obese. So, a diet which is essentially Indian diet, which is rich in seasonal, local fruits and vegetables, is the one which is going to help. Periodic checks. A lot of people remember in childhood, a lot of people play doctor. This kid will sleep and then the other person will give him an injection or a tablet. That habit goes into adulthood as well. So people try to diagnose themselves, try to think that this is. I asked a lady, you got a problem in your tummy. It's been there since 3 months. Why did you report it? I thought it was gas. How can you be? You are not a doctor. You have no business in diagnosing it as gas or anything. You cannot diagnose it as acidity or gas. You have to let the doctor do the job. So, keeping checks. We don't go to a doctor when we are ill. We go to a doctor only when we are sick. So, do you take your car to the garage only when the car has a problem? No, you still take it every 6 months for servicing. Why the servicing necessary? So that you need to check. The expert mechanic at the garage is going to have a look at your car and tell you if there is something wrong. And there is nothing, he's just going to clean, overhaul it and send it back to you. We don't do that for human beings. You don't go for checks. How often do you go for checks when you are completely okay? You never. So those are things which have to be done. These are following screening guidelines. Unfortunately, there are not too many cancers which can be screened. You can screen only for breast cancer, cervical cancer, colon, prostate, lung, few cancers, handful of cancers. But nevertheless, these guidelines have to be followed. Screening is not something which happens very often in India. That is why in India about 60% of the population, breast cancer population, presents to us in either stage 3 or stage 4 disease. Whereas in the United States, 90% of the crowd presents in stage 1, stage 2 disease. That is why their results are better, obviously, because they present at an early stage. It's not that they do different treatment or they are very great at surgery. No, the same surgery is done. If you present at an early stage, that's how you do.
So today we are seeing the technology is growing so fast. So do you think that the AI technology and the medical field should go hand in hand in treating patients?
They are going hand in hand. There are a lot of things, lot of applications where AI is already into place. A lot of AI and machine learning things are happening. So, for example, reading slides, reading pathology slides. A lot of it is, a lot of AI algorithms are coming into place. How you can pick up the abnormalities faster. So, deciding treatment algorithms. Simple thing like deciding screening. So suppose you want to screen yourself, you're a 20-year-old boy, we have no problem. But you want to know about your health. So you just type in your details, demographic details, I'm so and so, this is my weight, this is my height, this is my family history. AI is going to give you a pattern of actions. And this is what you need to do.
Thank you so much, sir. On the behalf of our principal and the staff, the day school family, we thank you so much, sir, for being with us. To have it up. We are very grateful to have it with you. It will definitely help us to choose our careers.